see my screen at least?
Yes.
Yay, then it's working. Okay, so let's get started then. Thank you everyone for joining and being patient with us while we get the Zoom platform going. My name is Megan Dotson, and I'm the program manager for the National American Indian and Alaska Native Mental Health Technology Center. We have the presentation today with special guest speakers Rose Olmsted, John Weaver, and Carson Gardner. Your self-care and psychological first aid in your care for others during COVID. So we're part of this MHTTC network that you can see here on the screen, and we have a national coordinating office, and then all of these centers across the country that are regional that we collaborate with. So just so you know, we have to have this disclaimer that the National American Indian and Alaska Native Mental Health Technology Transfer Center is supported by a grant from the Substance Abuse and Mental Health Services Administration. The content of this event is the creation of the presenter, and the opinions expressed do not necessarily reflect the views or policies of SAMHSA, HHS, or the American Indian and Alaska Native MHTTC. These are all just housekeeping details. Following today's event, you will receive a follow-up email because you did register, and that will have the link to the presentation recording. So we're going to house that on our YouTube site, and so once it gets uploaded, you'll be able to view that if you would like to see these recordings again. We also do have a couple of surveys that I will include in that email and in the chat as we get further into the presentation today. So each time we do a webinar, we like to, because we're virtually, we just want to take the time to acknowledge that about the land. And so we do want to pay respect to the indigenous nations whose homelands were forcibly taken over and inhabited. Past and present, we want to honor the land itself and the people who have stewarded it throughout the generations. And this calls us to commit to forever learn how to be better stewards of these lands through action, advocacy, support, and education. We acknowledge the painful history of genocide and forced occupation of Native American territories, and we respect the many diverse indigenous people connected to this land on which we gather from time to time immemorial. So while injustices are still being committed against indigenous people on Turtle Island, today we say thank you to those that stand with indigenous people and acknowledge that land reparations must be made to allow healing for our indigenous peoples and to Mother Earth herself. So this land acknowledgement was put together by 3 of our staff members who are members of the Meskwaki settlement in Iowa, Ella Driscoll, Keely Driscoll, and Sean A. Bear. So thank you for letting me take the time to acknowledge that. So 3 speakers today we mentioned. First one is Rose Olmsted, and she is a disaster mental health volunteer instructor who's worked 38 years as a social worker. Thank you, Rose. Supervisor and coordinator of crime victim services and coordinator of a Nova crisis response team in Minnesota. And since 1989, Rose has been a mental health care corps volunteer on the Southeast Minnesota Emergency Medical Services CISM team. She has been a Red Cross volunteer, as a disaster mental health team member and instructor since 2009. And since 2020, Rose has been volunteering as an instructor for the Red Cross Virtual Family Assistance Center, which we'll tell you about today, providing individual and group support for frontline workers during COVID, facilitating groups for employees and supervisors, and instructing psychological first aid classes during COVID. So as a mental health volunteer, she takes call shifts for the RCV FAC, taking calls from individuals whose loved ones have passed due to COVID as part of a multidisciplinary call center. And starting in 2021, Rose has been doing outreach to American Indian communities and those who serve them to offer individual and group support, as well as instructional classes. So we thank you for all of your hard work, Rose. Second speaker is John Weaver, and he's an author, consultant, and clinical, social, worker from Nazareth, Pennsylvania, and he's worked for 32 years as a crisis worker and caseworker supervisor for Northampton County Medical Health in Bethlehem, Pennsylvania. Thank you, John. He has served as a member of the adjunct faculty for DeSales University, Mary Wood University, and Northampton Community College. And throughout his career, he's written many articles, several chapters, and 3 books, including Disasters, Mental Health Interventions, and many of the works promote volunteerism in the American Red Cross. So he's also appeared in several video productions, including the 2015 documentary film Portraits of Professional Caregivers, Their Passion, Their Pain. And you can see a link here if you'd like to view that. And it explores the emotional costs of helping others survive traumatic events. He's been an American Red Cross volunteer since 1992, celebrating 30 years. Congratulations. And he serves as director of their Virtual Family Assistance Center, and he is the Central Atlantic Division's advisor, lead volunteer. So thank you very much, John. And our last speaker today is Carson Gardner Md, and he's a Anishinaabe elder, Bear Clan, and old family doctor, a poet, a pipestone carver. Okay, forgive me if I do not pronounce this right, but I'm going to try. And an Adizukanini.
Very, very close. Good job.
A sacred storyteller. He has spent the past quarter century living, working, praying, and learning with his Eagle Clan wife, Gail, of 48 years. Congratulations to you. And on, okay.
I'll say that. Gawa Babi Ganikag.
Yes, I tried. I'm so sorry. And my apologies for not knowing this native language. Thank you for correcting me. Land of abundant white clay, the White Earth Ojibwe Reservation in northern Minnesota. Go ahead, and you can say this better than me.
Gawa Babi Ganikag. Gawa Babi Ganikag.
Gawa Babi Ganika is his heart's true home. So thank you very, very much for being with us today. And right now we're going to actually pause, and I'm going to have Parker hit pause on the recording because we have a special prayer. And what we're going to do now is we're going to show you a Virtual Family Assistance Center video. So please go ahead and put your volume up in case you cannot hear me very well. This is a little bit quiet, but I'm going to make it louder for you. So here we go.
Hi, I'm Christopher Domshot with the American Red Cross, and today I am happy to introduce you to a program called the Virtual Family Assistance Center. I had the pleasure to sit down with 3 amazing Red Cross volunteers that are a part of a team of individuals working to provide help to communities going through challenges, emotional distress, and even the loss of loved ones. This team is working around the clock to provide emotional support, as well as resources on the federal, state, and local levels. But most importantly, this team is there to listen. Join me as we listen to the experiences of these 3 Red Crossers and what it means to be a part of this team. Hopefully you will be inspired to be a part of it too.
VFAC stands for Virtual Family Assistance Center. As the death toll started to mount last year from COVID, we decided the Red Cross needed to respond and support the families and support the caregivers who were dealing with it. So we brought together a small team of people from health, mental health, and spiritual care. And over a 4-week period, we developed the Virtual Family Assistance Center. Our call center agents are offering condolence support. They're talking to people and mostly listening to their stories about their loved ones lost to COVID. Or we're supporting many other people who haven't had a loss of a friend or family member, but they've lost a job, they've lost home, stable housing kind of things because of income loss or employment loss or things like that. So we're helping people find resources for that sort of thing too. And we're supporting community caregivers. Another component of the program offers free virtual training in psychological first aid or coping in today's world for staff at human service agencies or organizations that are somehow supporting the public. And in addition to doing trainings, we do listening sessions. So if there's a hospital unit that's lost a lot of people, or an ambulance unit that's had traumatic experiences during COVID, and they just want to talk, we'll sit down with them virtually and do a listening session, listen to their stories, and then offer some psychoeducation and support at the end of that listening session.
I was deployed for 2 weeks last September, and then they asked if I would stay on for another 2 weeks, and I did, and then I never left. There is a need for others to reach out and support those who are in need, those who need assistance, and sometimes just resources to have someone hear their story.
Becoming a volunteer with the Virtual Family Assistance Center has made a huge difference in my life. Every day I'm on the phone, every day I'm in a different call, every day I know I'm touching someone's life. When they say thank you at the end and you know that you've given them something that they couldn't find anywhere else, even if that was just a kind ear, you know you've done something well and you know you've made a difference. With COVID-19 spreading around the United States, we often just see things on the news and don't know how we can help. This is a real difference that you can make in everybody's life who's been affected. I would recommend anybody that's interested in giving the VFAC line a try. You get to set your own shift. You're not waiting for a call in the middle of the night. You decide when you want to be on and you decide when you want to be off. In addition to that, you get the support of the rest of the volunteers who check in every day with daily calls. If you want to, you can discuss your cases, see how things went, but you also get to listen to other people in other positions, and you get to learn so much by seeing what they have done, and that helps us in our own responses.
The VFAC has been continuously active since May 12th of 2020, supporting COVID families. But in addition to that mission and supporting the community caregivers, the Red Cross has used us as a bit of a Swiss Army knife to do some other things as needed. During the Oregon wildfires, we reached out to every volunteer and staff who was serving there because many of them were Oregon residents who were displaced from their own homes. So we were staff support for those folks. Over the course of our entire operation, I think we've had about 200 volunteers active at any given time. We usually have 20 or 30 people that are taking shifts. And it has changed. In December, we started to make the transition from 2-week deployments to part-time operation, where people can sign up for a shift of 6 hours length and do 1 shift a month, 2 shifts a month, whatever their schedule would allow. So we're able to cover our shifts that way now. It's an individual response. The individual can just call our 800 number and get individual support from one of those call center agents. Should there be a big mass casualty event or some other special need, we can gear up, we can add more operators, we could go back to a 7-day-a-week operation. We might even need deployments again for the volume of calls. So all of that's possible as we move forward.
One of the things I like the most about the VFAC line is that you never know what kind of call you're going to get. I've had a call from someone from a church who was calling in for one of her parishioners, and after talking, I was able to give her resources that she's going to be able to spread throughout her whole hard-hit community. I've also had a call from one man who lost his father to COVID, who simply wanted to know how much his father had donated in blood over the years. Using our resources, we were able to get that number for him and also get a certificate made up, something he could take to his father's memorial. It seems like a small thing, but it was huge to him. His father had donated 33 gallons of blood over his lifetime and was very proud of it. So the variety of the calls that you get, it's just such a learning experience, and you never have the same day in a row.
I was working with a woman and who had a child, She had been put out of her home. She had nowhere to go, and had no resources. And she had reached the end of her rope. We looked for every resource we could find. And then I started just Googling other resources besides the findhelp.org. I started Googling other resources in the area she was in. I could not hang that phone up without knowing that I had done everything that I could to find a place for her. And through that, I was able to find some resources for her, gave her numbers to call, and she was able to find a place to stay for the night for her and her child. Those are the kinds of things that we do at VFAC.
One of the first calls I got was from a woman who had lost her mom. And the story was that the mom got so ill at home that the woman called the ambulance and watched them load her up and never got to see her again, because that was the nature of this kind of work. And some of the added components were that she never got to say goodbye. She didn't get to see her again or anything like that. But where she went for treatment was the hospital where the daughter worked. And so there were so many little nasty components to this that even though she worked in that hospital, she wasn't allowed into that area because of the early issues around safety and everything. And so it was a very sad call. And we went through all of this stuff, and she talked a lot about her intense memory of seeing mom get loaded in the gurney and taken away. And so I said to her toward the end of the conversation, how are you going to remember her? Because you don't want that to be the thing you think about every time you think of mom, that loading her in the ambulance experience. I said, tell me about a happier time. And she told me about their tradition of going out for a big breakfast somewhere once each week. And this woman who died would order the biggest breakfast on the menu, where you get 2 of this and 1 of that and everything under the sun. And every time she did that, she'd give away the waffle. She didn't want the waffle, but she always ordered it. And then she'd give it away to somebody else in the restaurant. And she just remembers her mom doing that act of kindness every time they went out for a big breakfast. And I said, well, that's the kind of thing. You don't want to get stuck in the angry and sad thoughts about those final moments of an unfriendly goodbye, a distant experience. And she got that. And that seemed to give her some relief instantly, that whenever those sadder, madder thoughts popped into her head, she had a different place to go in her mind.
We are blessed with an amazing group of volunteers across the spectrum. We have health services, mental health, spiritual care, and casework volunteers. And they are dedicated, and as I said, it can be emotionally draining. It can be. And our volunteers need respite from doing this day in and day out.
It's special people that are on this line that are willing to take these kind of calls. You know, you don't want to scare anybody off of it, but they're heavy calls, and we have a really strong support system that sticks together for this. And they always back you up. They always make sure that you're okay after your shift as well.
We would love to get more caseworkers involved. We'd also like to get more health, mental health, and spiritual care workers involved. Some of the needs, it's 1 shift at a time, couple shifts a month is kind of the minimum. And it's 9 to 3 or 3 to 9 Eastern time. So generally people can work out that shift pattern. One of the things that's nice is it's all done virtually. So you can do it from home. You don't have to deploy under our current configuration. And people that would like to get experience in ICCT may come from a region where there's not a lot of fatal fires or anything, can get a truly blended team approach ICCT experience working with our VFAC team. This isn't for everybody. It is tough work. It's intense, the calls, and you'll remember them forever, some of them. They'll be a part of you. So as long as you're up for that, we'd love to have you.
We need volunteers to answer phones, speak to people, provide support to those who are in need, and to be a voice and to be a listening ear to those who are in need of care and compassion.
Thank you for taking the time to learn all about the Virtual Family Assistance Center and listen to the experiences of these 3 amazing Red Cross volunteers. If you're interested in further information on the program, you can always visit redcross.org/VFAC. And if you're interested in learning about how you can become a part of this team, please email condolencecare@redcross.org. Most importantly, if you're somebody that's watched this and you feel like you need somebody to talk to because you're going through some challenges or emotional distress or even the loss of a loved one, we are there to help you. We are there to help each other. Call 833-492-0094. Thank you and have a wonderful day.
Okay, thank you for sharing that video with us today. And now I would like to have Rose speak to us about some of the work she's been doing. So Rose, thank you if you want to take it over.
Thanks. Actually, John was going to make a few comments before me. So I'm going to let John make a few comments and then he'll hand it off to me. Go ahead, John.
The video was really made for internal use to help us recruit from our existing core of Red Cross disaster volunteers, but it's the only thing of this type we have to sort of illustrate what we're doing and how we're doing it. So be happy when we get to question and answer to answer any questions you might have. But the Red Cross is constantly seeking more volunteers for all of our 5 lines of service. But I volunteer in the disaster line. And if any of you are viewers today, or if anyone you know is interested in helping out, not just with this kind of thing, because this is kind of specialized work, but the Red Cross would love to have more folks to help with feeding and sheltering when floods and tornadoes are happening, like we're seeing already this spring and things like that. And all the training is free, and we just love to be as diverse as we can be. So we like to get recruitment messages out to everyone, and pretty much they can find a role for anyone. So if you're interested in doing that, it's redcross.org/volunteer, and then it'll ask you for your zip code. And once you do that, it'll ask you what kind of thing you're interested in doing. And you can do something you're really good at, or you can do something that you've always wanted to do and just train for it. It gets a little complicated with our team, because to do the mental health part, you have to be a licensed mental health professional. To do the health services part, you have to be a licensed nurse or physician. Spiritual care has certain requirements for people that are doing that function. But the most general and easy to get in is the casework one. So you would take the training for whatever it is you're interested in. And then if this team happened to be something you were interested in, there's 2 courses on top of the regular training that we ask all of our folks to take. One is ICCT, and we mentioned those letters in the film, but didn't tell you what they meant. It's Integrated Care and Condolence Team. So that's the multidisciplinary team that has health, mental health, spiritual care, and casework. So we ask people to have their basic training plus ICCT and mass casualty incident basics. So they know a little something about that, because our unit is available when a building collapses or when there's an active shooter incident or things like that. So it's not just supporting the COVID loss families. So that's kind of quick, basic response. Rose, back to you.
All right, thanks, John. So I just have to brag a little bit. You know, I've been part of the team now since, I think I met John back in June of 2020. So I just want to brag that our co-directors, John and Rodney, have been selected as not first winners, but second runner-ups for the National Red Cross Humanitarian Award. And it is so cool that they got that, because that's what they're about. I would not have stayed on this team as long as I have if it wasn't for the support that I received from our leaders, John and Rodney, as well as the rest of the team. We really are a close-knit group. And I've made a ton of, I say a lot of connections, new friends with people from all over the United States, because the team is made up of people from all over the United States. So I want to make sure we have most aptly have the time for Dr. Gardner. So I'm going to run through some things very quickly. First of all, I want to acknowledge and thank all of you as first responders. Any of you who've worked during COVID, my heart goes out to you, and I want to thank you for all that you've done during COVID. We are here to support you. I want you to hear that the VFAC team, as an instructor, I've been doing, you heard John talk about the listening sessions. I've been doing some of those listening sessions where folks are able to come together. There might be a group from a hospital, it might be a group from a behavioral health program, who come together in a confidential setting to be able to share what their stressors have been during COVID, while they've had to work during COVID, and how difficult it's been to look at trying not to bring COVID home to their loved ones, to their children, to their family, being absolutely exhausted because of all the hours they've put in and all the nonstop activity. In the short time that I've known Dr. Gardner, you know, he's one of those frontline workers who's been working day and night to make sure that he's taking care of his people on his reservation who are needing COVID care also. So a big thank you to all of those frontline workers for all that you've done. Know that we want to be here to support you as frontline workers. If you're ambulance service providers, if you're firefighters, if you're doing all those transports, let us know if there's any way we can be supportive. Some of the things I've done is to be able to meet with the employees, and then they've gathered up their comments about what's been most difficult and challenging for them. And then I've had separate meetings with their supervisors. So supervisors, the employees have a chance to confidentially share what their issues are. And then the supervisors have a chance to hear from the group what the stressors been for those frontline workers. We've also, you know, we take calls individually from frontline workers. So know that the VFAC Center is there for you as frontline workers, and that we want to be there to support you. So let us know if there's any way individually or as a group we can be supportive. And we will cater the meetings with you in any format that makes sense for you. So I've done 3-hour sessions, I've done 2-hour sessions, I've done 1-hour sessions. One of the things I respect about my leader, John, who's my supervisor as an instructor, is that he cares about what makes most sense for the people we're serving. So he's not stuck in a bunch of rules. So if I say, John, can I do this? Can I do that? He's pretty open to hearing what we want to do, which is why I approached John some months ago to say, John, I've taken calls from Native American folks who've lost their elders. I've taken calls from Native Americans who've lost both their parents, and they're looking for monies before the monies were available from FEMA, looking for monies to bury their loved ones, sometimes 2 of their loved ones. I said to John, John, may I do some outreach with Native Americans to be able to look at giving them information and letting them know about our program and offering them the services that we're providing in psychological first aid and frontline worker support. John said, go for it, Rose, if that's what you want to do. I was very lucky to be able to hook up with So I've done presentations in California, Nebraska, North Dakota, South Dakota, Minnesota. It is in Minnesota that I met Dr. Gardner. I feel privileged to have met Dr. Gardner, and I feel privileged that he's here with us today, joining us in this training, and that he and I are going to get to do that 3-hour training together on April 21st. So please come back if you can. It'll be Dr. Gardner and I on April 21st. We're thrilled to be able to do it. I've already learned a bunch from Dr. Gardner. I'm not Native, I'm non-Native, but I've always had a heart for Native American folks. And I can assure you that the trainings that I've been doing only adds to my heart for Native American folks. So I'm going to stop at this point and turn it over to Dr. Gardner. Thank you.
Well, thank you all. Chimigwech, Pilamaya, and my favorite Lakota spiritual word, Wopila. I thank all of creation for you and for your place in creation. But before I go on, I want to thank Parker. I was exercising my Ojibwe sense of humor and teasing him as he was helping us to get on the air through our problems. But I just want to point out the obvious. We all owe a great debt of thanks to IT professionals who have kept us all sane through the COVID pandemic, when our only connection with loved ones and friends was through online platforms. So Parker, thank you. Miigwech, Chimigwech, Wopila. I kind of have one foot in Western medicine and one foot in our traditional community. I'm an Edizukananini, a teller of sacred stories, and again, exercising my sense of humor, I'll have to say, 15 minutes as a sacred storyteller, I can't even introduce myself in 15 minutes. So Rose and I and John puzzled over what I could say that would be of use in this short period of time that I'm very thankful to have. Rose suggested I talk about smudging, and I think that's a wonderful idea that's often overlooked. You may all have seen a Native person do smudging at the beginning of a meeting or a ceremony, but nobody ever talks about what it means. So I'm going to talk about that today briefly. I'm very thankful to be working with Rose. The reason I'm here today is because Rose did a 3-hour psychological first aid session for our White Earth Nation tribal home health nurses, and it was very, very helpful and healing. So as those of you who are Native people know, when you receive a gift of great spiritual value, you return a gift that you believe to be of equal value. So I'm doing my best here, but it's hard to top Rose in her healing work. So let's talk about smudging. What's the deal with this smudging anyway? Most Native people have the tradition of smudging, and it's a healing tradition. We've been doing smudging for thousands of years. The Ojibwe word is Nukwezigan, and the words for the 4 medicines we use are Mushkodewash, Wingush, Gijik, and Asema. And of course, in English, that's sage, sweetgrass, cedar, and ceremonial tobacco. We, Ojibwe or Anishinaabe, what we call ourselves, used ceremonial tobacco in past centuries that was made from the inner bark of the red willow and other herbal medicines like bear root. So let's talk about sage first. I smudged with sage at the beginning of this meeting. Sage is used in smudge to symbolize the removing of the negative from one's life. We all collect a lot of negative baggage, and particularly during COVID. So smudging with sage is a ceremony that symbolizes letting go of the negative in our lives, and that's why it's done so frequently before so many different kinds of gatherings. The interesting thing about sage is there are scores and hundreds of varieties of sage all over the world, all over Turtle Island, all over the Americas. You can find sage wherever you go with very little need for detailed education. You can find sage, you can pick sage, you can dry it, you can use it to smudge. And the message for us here is that Creator's waiting to wash away the negative in our lives and is ready and willing at our slightest request for help. So that's a really good teaching. Sage can also be made into tea. It can be used as a ceremonial wash to symbolize cleansing and healing of wounds. And we use it for all those reasons here. So let's talk about sweetgrass. You've seen the sweetgrass braid that represents the hair of Aki Nukumus, our grandmother, the earth. And our grandmother has provided us with every good thing we need to survive, because we human beings are the most dependent creatures on the face of the earth. We need a lot of help from all the rest of creation, and we get that help through Aki Nukumus, the earth itself. So the reason that we smudge with sweetgrass is to actually encourage the positive to come into our lives. And it's a very interesting thing. I asked one of my traditional healer friends here on Gawa Babi Ganikag, say, where do you get your sage? Where do you get your sweetgrass? I need to get some. And he laughed. He said, well, frankly, I steal it from my neighbor. And then he explained, you can't find sweetgrass around here. You can find it in specific locations on the prairie. It's not easy to find and limited supply. So even though he's a very traditional person, he will buy sweetgrass on the internet or accept a gift from his neighbor who planted some. Well, what's the message in that? The message is this: it's easy to ask Creator to cleanse the negative from our lives, but if we don't replace it with the positive, then guess what? The negative is going to come back in again, because we're human and that's how we are. So it's much harder to bring the positive into our lives than to just let go of the negative. So that's a very deep teaching that I think can be beneficial to all of us as we struggle here through our third year of the COVID pandemic. Let's talk about cedar. Cedar was the first tree that Creator gave to Native Nation people, at least according to our stories. It's very useful for many things. It can be made into a tea. It can be made into a body wash. We have a ceremony called the wiping of tears. And in that ceremony, you stand barefoot in the center of the circle, standing on cedar boughs, and your friends and colleagues brush you off with an eagle feather fan, and you're also ceremonially washed down with a cloth that's been soaked in cedar water, and it's just ceremonial. You don't get a bath or a shower, but it symbolizes healing. Cedar can be consumed as a tea. You can put cedar solution into a bath and actually bathe with cedar. And the other thing is, I mentioned the cedar boughs on the floor. Cedar is very protective, and so standing barefoot on those cedar boughs is not just coincidental. There's a phrase in our Ojibwe language, Gawin Anisha Indijichagasin, and it means I do not do this without a reason. Every aspect of all of our Native Nations ceremonies has a purpose, and the purpose of those cedar boughs is to provide protection so we are not assailed in our most vulnerable moments as we seek and accept spiritual healing. And finally, a sema, ceremonial tobacco. I just recently heard a spiritual healer say that a sema, ceremonial tobacco, is the currency of thankfulness. And I think that's very beautiful. The Ojibwe are happy to be known as the thankful people. And Creator gave a sema so that when we received a gift from the earth, we could symbolically put down a pinch of that tobacco to say thank you. I know that without your gift, I would not be able to survive, whether it's a deer kill to put venison on the table or harvesting our gardens or whatever it may be. A pinch of tobacco is put down specifically to acknowledge that we human beings are the most dependent creatures on earth, and we need help from all the rest of creation if we are to even hope to survive. The other use for a ceremonial tobacco is in offering prayers. It's ceremonial. I heard in 2014 an elder of an advanced age point out the fact that, quote, we Native Nation people have ceremony coded into our DNA, close quote. And I love that. Advanced elder 2014, he knew about genetics as well as genealogy. So he said, we have a ceremony coded into our DNA. It's there to help heal us. When you see a Native person take out a pipestone pipe and load it with ceremonial tobacco and smoke it, there's a story behind that. Gawina Nisha Indijicha Gasin. It's not by accident. There's a story of how our prayers ascend symbolically with the tobacco smoke, and because we're human beings and we're not capable of praying perfect prayers, other creatures such as Migazi, the eagle, and Anamaki Benesi, the thunder being, carry those prayers ceremonially to Creator, Gitchimani Du Wakantanka, whatever name you use for Creator. And in the process, they're made into better prayers than we know how to pray. So I need to wrap it up here, but I want to point out a couple things. Western medicine neurophysiology points out that human sense of smell receptors in the back of the nose are the only nerves in the human body that go directly into the brain. They don't go through the spinal cord, they go directly into the brain. They go to the limbic system, and the limbic system is the part of our brains that are often wounded by generational trauma, personal trauma, anxiety, depression, grief, and substance misuse, among other assaults on our minds. And so the symbolic aroma of these medicines and smudging go directly into our brain, to the place where we need healing the most. The other thing is that psychology, Western psychology, has established that if human beings take time several times a day to repeat a simple phrase that affirms positive thoughts, it will actually help to bring psychological, emotional, mental healing to them. But we're all too busy in the 21st century to remember to do that. Smudging works for that. That's why many of the people I work with in healthcare and behavioral healthcare smudge often during the day. Well, why do they do that so often? They did that this morning. Isn't once good enough? I guess it depends on how tough your day is, how many wounded people you see, and how you struggle with continuing to give your strength to help other people. So you see, Western medicine, even though many doctors don't realize that Western medicine supports the medical and psychological value of the smudging ceremony. Creator gave that to us thousands of years ago because we needed it all along, and we certainly need it right now during the COVID pandemic. So I need to stop, but I'm going to tell you that when Rose and I have 3 hours, I am going to talk about how 7 great Native teachings help us to better understand COVID stress and better formulate personal healing and healing for the people we serve. And then I'm going to tell you a beautiful story. It's the most beautiful spiritual story I've ever heard. And I've heard a number of spiritual stories. It's called the Chi De Weigan story. And it can't be recorded. It can't be written down. It can't be published in a magazine. It can't be published online. 150 years ago, Oyate and Anishinaabe elders agreed that this story of cleansing and healing and balancing and protection could only be told face to face. Thanks to people like Parker, face to face has come to mean by online platform, and thanks to people like Megan, it won't be recorded when I tell it. But if you go to Anishinaabe or Oyate ceremony, you'll spend 5 hours hearing the story, but only if you speak Ojibwe or Dakota. I'm going to tell it in English because I've been given permission to do that. So we will do that on the 21st of April. And then if there's time, I'll also talk a little bit about gifts and balance and how Creator offers to bring us all out of COVID chaos and back into balance. So that is almost all I have to say. And hopefully Megan and Parker won't strangle me, but I'm going to read a poem that I wrote after participating in Rose's psychological first aid session. It's called I Choose to Dance On. I am alive. I feel pain, but I am much more than my pain. My pain is not your pain, and yours is not mine. I give my pain its place in my circle dance. My pain is like the wind. My pain is like the water. My pain is like the fire. My pain is like the stone. The wind grants me breath. The water grants me cleansing. The fire grants me light. The stone grants me a path. I do not control the air, but I breathe. I do not control the water, but I wash clean. I do not control the fire, but I see. I do not control the stone, but I dance. Moving through my pain to discover joy is a way to be alive. I move through my pain, discovering the joy in meaning, purpose, and service. My pain does not define me or limit me, but it does acknowledge pathways toward my joy. In thanks and with mercy, I choose to dance on. Miigwech pila maya, meet you, aho.
Very much, Dr. Gardner. I knew of the poem, and it was really beautiful when I read it. So thank you for sharing with the group today and all of your knowledge and wisdom and teaching us about smudging and the use of tobacco. I did have one question from Mary. She wanted to know what type of tobacco was used. Could you speak to that for a second?
Yes, I can. I heard a very honored regional spiritual teacher say, you know, it's the modern world, we're all busy, so we go to the store and we buy a pouch of pipe tobacco. Even better than that would be to use organic Virginia leaf tobacco that has no chemicals in it. If you've looked around and read a little bit, you realize that commercial tobacco companies put over 500 different chemicals at one time or another into commercial tobacco. The best, this regional healer said, would be to learn how to make ceremonial tobacco in the traditional way, using the inner bark of red willow and bare root and other herbs. But he acknowledged, you know what, if you're so busy and you don't know where to get red willow bark and you're not sure about organic Virginia leaf tobacco, then just get a pouch of pipe tobacco. But he has encouraged schools to use traditional tobacco because it doesn't interfere with their non-smoking policies on school grounds, including our own tribal schools. So that, I guess, is the best answer I can give you.
Anybody else have any questions today for all three of these folks? We're about at the top of the hour, so please feel free to unmute yourself and ask. And I'm trying to do the link here, 1 second. But in the meantime, feel free to unmute yourself. And this will be sent to you in the email that you'll get. So you'll have the registration link in the email that you'll get as well.
Megan, I just want to thank you and the center again for giving us this opportunity. I know that it was, when John and I first met you, it was an unusual opportunity to look at Red Cross trying to build a connection with your organization, but thank you for this opportunity. And of course, I have nothing but high regard for Dr. Gardner, and my people who work with me on the team know that I do nothing but brag about the chance that I get to be involved with Dr. Gardner. And there's a second thing, is that after the training in April 21st, I've been asked to do a training in person up in Cass Lake, Minnesota. And I found enough nerve to finally ask Dr. Gardner if I would be able to meet with he and his wife if I drive after that Cass Lake training. So on Sunday, April 24th, I get to be in the presence of Dr. Gardner for the first time. And I'm just thrilled to no end to be able to be in his presence. It's going to be an honor. So thank you all for joining us today.
Then Rose will find out that I'm really only 4 feet 3 inches tall.
I already know he has a great sense of humor.
Well, thank you guys. There was one question left. Do the Native Americans in Arizona have similar practices and beliefs?
My answer would be that I am not trained in Dene spirituality or Zuni or Pueblo spirituality, but we had a wonderful IT trainee here at our Indian Health Service clinic named Will. And Will and I talked a lot, and my conclusion is that the Pueblo tribes, nations have many similar practices. So I don't know about the specific details, and I wouldn't try to pretend that I know, but I think for nations all over Turtle Island, smudging of some type is a basic ceremonial healing process. So
Thank you for that. I'm going to throw up the slide real quick one more time, and then we're going to end today's webinar. And I want to thank all of you for joining and all the people who spoke today. Parker, for your IT help. I honestly don't think this would have worked without you. So thank you so much. And if anybody has any questions, I'll put my email here in the chat as well. Just trying to do a couple of things at once, so give me a sec. Can you see this, everybody? No? Yes?
Yes.
Yes, okay, good. So this is the link to register. It's in the chat, and then we will obviously send this in the email as well. So thank you all for joining. I will say goodbye now, and maybe we'll see you on the 21st, and I look forward to it.
Thank you.
Thanks, everyone.
Okay. Bye-bye.
Bye, everybody. Thank you.
Thank you.
Thank you.